The Center for Healthful Behavior Change is in the Division of Health and Behavior in the Department of Population Health. The mission of the center is actually to develop, implement, and translate evidence-based interventions to improve chronic diseases.
In the context of health equity, which is to try to understand what the barriers might be preventing adequate access to care, we're finding that quite a bit of mistrust or distrust of the healthcare system. So we find that when we engage members of the community, there's a much better chance they will actually participate in healthcare practices.
Each of us are studying different chronic diseases, but some of the common themes there are access to care and ongoing disease self-management, which are challenging. So I think there are some creative approaches in the center for reaching people on an ongoing basis.
Most of the work we do is focused on really developing health behavior change interventions. We're focused on reducing the disparities in cardiovascular diseases. Stroke, some is focused on high blood pressure, some on diabetes, and some on chronic kidney disease. Our center has an NIH-funded project. This is a center for the reduction of stroke disparities. The aim of the center is to actually develop interventions and strategies to reduce the differences that you see in stroke outcomes between blacks, whites, and Latinos.
My research really focuses on two conditions which are major killers of black men: hypertension and colon cancer. And my work really focuses on community-based approaches to addressing those two conditions. And so what we do is we actually try to move our work outside of the walls of the healthcare system and actually go out into the community. We've been very fortunate to get NIH funding to actually look at the impact of utilizing barbershops as well as faith-based organizations to reach black men. It is important because I think it's the only way that we're going to achieve health equity, by actually going to where the people who are in need are.
In minority communities, Latino and blacks in particular, sleep apnea is a very serious problem. So we now just started a new project which we call PZ, where we have P-health educators talk to their clientele to try and engage them in conversation about why they should get a sleep test done. Not at the hospital, but at home. The other project, which we call TASH, is about engaging members of the community, churches, barbershop, beauty salons, trying to understand what the barriers are and also come up with a platform that is very scalable. In this case, we're talking about websites as well as text messaging as a way of increasing sleep health literacy.
My work focuses on the role of sleep health in cardiovascular disease outcomes. For the past 3 years, I've been working on what's called the metabolic syndrome outcome study. So we took a lot of time during the formative phase of the process, conducting focus groups in community-based settings, talking with African Americans or blacks, and we wanted to find out what are some of their general attitudes and beliefs about sleep apnea. So we took all of that intervention and we developed a curriculum. We trained health educators. It included a culturally sensitive training. We looked at all of the different barriers to being screened for sleep apnea, as well as adherent to treatment. And so the health educators will work with participants via telephone and counsel them.
My research looks at the effect of race on patient-provider communication and then how that affects whether or not patients take their medication. I really try to analyze the quality of communication between the patient and their provider to link that to the behaviors that patients engage in. So we audio tape visits with providers. We look at really what makes good communication and then how that affects patients. And my training work really tries to train nurses and other clinic workers to deliver care coordination services so that patients can stay out of the hospital and improve their quality of care.
One of the goals of the center is research, but also looking at ways to train the next generation of behavioral scientists to do this work.
We do have at the center several funded training initiatives, one of which is the program we call PRIDE, Program to Increase Diversity in Individual Engaged in Health Disparities Research. The focus is really to train underrepresented minority faculty and to help them excel in the academic venture. Based on our recent evaluation, we find that our PRIDE scholars have a success rate over 30% of their grants are being funded compared to The regular faculty that are applying to a regular cycle are about under 17%. The approach we've been using has been very successful.
I work with patients that have diabetes, patients that have diabetes and concurrent chronic kidney disease, which is a common complication. I use technology to try and help patients make multiple behavior changes and do what they need to do to manage these very complicated medical management regimens and lifestyle regimens. If you have a technology that is user-friendly, one that people think is going to result in improvements or help them do a better job of managing their health, that they will in fact use it.
Epilepsy is a really difficult chronic condition for many people to manage. What we're trying to do is help people with day-to-day self-management. With epilepsy in particular, you really need kind of almost perfect adherence to prevent seizures. Just missing one dose can result in a seizure. We're developing a new set of tools using this technology-supported platform, using a smartphone. We're using some tailored text message tips people will receive to their phone on a weekly basis. One of the, I think, really unique features of this is the video component, discussing different self-management topics from both a physician perspective and the patient's.
It's really by bringing together these different viewpoints that we think we're going to be able to solve the challenges of the complicated world out there as they affect health.